We were next door neighbors. We played together when we were little, and we got together and dated, and then we got married.
I don't think most men think about it at all. I think it's felt to be a woman's type of disease and that they don't really feel that they're at risk. So, breast cancer can present as a lump in the breast, but it can be other changes as well, such as to the skin. There could be a rash that doesn't go away, or thickened dimpling type skin, or changes to the nipple, like either discharge or an inversion of the nipple.
I was concerned more than him. I seen it when we went to the gym. Him and I went to the gym, and it was that he had a blood on his t-shirt when we were finished doing our exercises. And also one person at Falconbridge mentioned it to him that there was a growth or something that he should get looked at. I was scared. I didn't know if he was going to die or what was going to happen. It was very hard.
I think it was a shock. I guess I didn't realize that men could get breast cancer, so that was number one. But also, he was my dad, and I never saw him sick, even with a cold or a flu. So to have him go through something like this seemed almost impossible. So I guess that's just, I never believed that, it would be my father and that would be the first to go through this. So
initially, I wasn't overly concerned. We thought he was just going in to have a simple little lump removed. We assumed it was probably not very much of any concern. And then suddenly, immediately after his surgery, we discovered that it was actually considered cancerous. They had tested it immediately and discovered cancer and had removed a breast and several lymph nodes. So I think it definitely was shocking.
There's surgery. So, surgery can either be taking a piece of the breast, like a lumpectomy, or an entire breast removal, such as a mastectomy, as well as a radiation, chemotherapy, and then anti hormonal treatments.
I recall right off the bat, once he healed from his surgery, he started into chemotherapy. He was into regular chemotherapy, which affected his physical well-being. He was sick for days after the treatment. He lost hair and was just overly unwell for quite a bit of time. After that, he went through several rounds of radiation treatment, which affected his ability to be mobile in some situations just because of the sensations from the radiation.
I was sort of sheltered, I think, more from the all the treatments he did have. I know that he did have his one breast removed and that there was radiation and chemo that followed. As far as how many treatments or anything like that, I don't know exact details.
I've had a breast cancer survivor who's a male, so in terms of just checking that there's no recurrence, and then also a male who has a really strong family history, including a mutation that makes him at a higher risk. So we're doing regular screening with him to make sure that he doesn't develop it. I think men can be embarrassed about the risk of breast cancer or developing breast cancer. I think that they don't think it'll happen to them, and so they may not present right away to the doctors. There might be some shame around that. I know that in the patient that we've been doing increased screening, he's had to get mammograms, and I think there was a lot of shame about going for a mammogram because that's thought to be a female test.
What was his reaction? Do you think he was embarrassed about his diagnosis?
No, I think he was scared as well. I don't think he knew what was going on. I don't think he realized that men could get breast cancer.
I think our family maybe grew a little more tight knit. We kind of stuck together to get through this. But no, he was still capable of doing everything he always did. He did have to take time off of work. We just all kind of stuck together and supported each other more, I guess you would say. Yeah.
Yeah, I think his behavior definitely changed. He was always a very active individual, and not being and having to heal from the surgery, and on top of all the treatments, it definitely did affect his overall ability to function within his normal, typical lifestyle. We were also in a situation where there was family events coming up. My own wedding was happening the same year that he was diagnosed and had his surgery. So it meant finding clothing that was comfortable for him, finding a top hat essentially, or a bolero that he could wear that would cover up the fact that he was hairless at the time. But he definitely tried to be positive for all of us.
I had to take him for treatments, yes. Most of the time, though, he went by himself, but if I would go with him a lot of the times too.
Were you and your daughters scared about the cancer?
Yes, we were. All of us were. We were worried about what was going to happen with the outcome. He had to have the mastectomy done, and I wasn't sure what was going to happen.
So after his surgery to have his breast removed was when they came in to tell us that there was cancerous cells in his lymph nodes, and that he would have to do the radiation and chemo. So at that point, they were not sure how hopeful the treatments would be, and possibly we could only have him for another 6 months. So that was very shocking to us.
Family history is a big risk factor. So if there's a family history of male or female breast cancer, as well as genetic changes such as the BRCA gene mutations, but other genetic conditions for men such as Klinefelters can contribute. And there's a lack of understanding but thought to be an association with obesity or alcohol use.
Certainly affects me. I mean, with the family history, especially with a parent, and not only a parent but a father having had cancer, breast cancer, or my doctor recommends regular mammograms, so annual mammograms, ultrasounds if anything gets picked up. And I also obviously have concerns for my own family. My two girls are in the same genetic pool as I am, obviously, and so having them tested and just watching for any signs is always a priority.
Yes, breast cancer actually opens my eyes to see that there are a lot more people that do go through this, either, just something that they've found and are able to rule out as not cancerous. But as for myself, because my father did have breast cancer, I have been had to have mammograms and ultrasounds to keep an eye on things. And I'm also being enrolled in a genetic testing program to see if anything is genetic. There were, we have had a few something found but biopsied and nothing cancerous, so all good there. And so just always sort of top of mind and making sure that we're always prepared for anything.
In Canada, about 1% of breast cancer cases are male breast cancers. So in 2023, it was estimated there'd be 260 cases of male breast cancer, and that 55 of those men would die.
was your favorite memory with you and Papa T?
The memory of the day we got married, and the other memory is the one of having my 2 daughters.